Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. MR, that is a mitral regurgitation. So first we'll be doing the stages and we'll move on to the management. So first is the stage A. Stage A means at risk of MR. So there is risk of MR. And what is the valve prolapse and the coaptations? So it includes the prolapse. And this can be the mild and the coaptation. This will be normal. Now what will be the hemodynamical changes? It will be not seen. It is not seen. Next we move on to the B type. B type means it is progressive. So A means it's at risk and B times means it is progressive. So this is nothing but the progressive MR. So what is the valve prolapse and the coaptations? So the prolapse, if you see, it is moderate to the severe. And when you look at the coaptations, this is normal. Now, how are the hemodynamical changes? The hemodynamical changes in terms of the left valve, left LA enlargement. So this is to be mild. So LA enlargement will be mild. And next when you move on to the left ventricular enlargement, this will be absent. And now when you look at the pulmonary hypertension, this is not seen. So pulmonary hypertension is not seen. Now we move on to the type C. So here in the stage C, it means it is asymptomatic. So A was at risk, B is progressive MR, and C is asymptomatic severe. So it is asymptomatic and severe MR. So in terms of asymptomatic severe MR, the prolapse, it becomes very severe. So prolapse becomes severe, and when you look at the coaptations, the coaptation, it becomes lost. It becomes lost, and there's presence of the flyal leaflets. Now let's look at the hemodynamical changes. So in terms of hemodynamical changes, there is a left atrial enlargement. So here in left atrial enlargement, it is moderate to severe left ventricular enlargement. So it's moderate to the severe left atrial enlargement, and it is present with the pulmonary hypertension. So looking at the pulmonary hypertension, it is positive or negative at rest. So in type C, it is asymptomatic severe MR, the prolapse was severe, the coaptation is lost or flyal leaflets, and then LA enlargement, it was moderate to severe, left ventricular enlargement, it becomes present, and the pulmonary hypertension, it becomes positive or negative at rest. And then the stage C1 LVEF, let's write it down. The stage C1 LVEF, this becomes greater than 60%, and when you look at LVESD, this becomes less than 40 mm. Next we move on to the stage C2. So looking at stage C2, there is the LVEF. So LVEF less than equal to 60%, and the LVESD. So LVESD, it becomes greater than equal to 40 mm. Now let's move on to the type D or the stage D. So here in type D or stage D, it becomes a symptomatic. So it is nothing but symptomatic severe MR. So it's symptomatic severe MR, and when you look at the valve prolapse or the coaptation, there is presence of prolapse. So the prolapse, it becomes very severe, and when you look at the coaptations, it becomes lost. So coaptation, it becomes lost, and there's presence of the flyal leaflets. So how is the hemodynamical changes? So there is left ventricular enlargement. This becomes moderate to severe, and there's left ventricular enlargement which is present, and pulmonary hypertension is present. Now let's move on to the management of the severe primary mitral regurgitation. So now let's look at the management of the severe pulmonary mitral regurgitation. Severe primary mitral regurgitation. So here there are two types. That is, it can be stage C or stage D. So first let's look at the simple one, that is a stage D. So this is the algorithm. So in case of stage D, it becomes symptomatic. So the individual becomes symptomatic. So if it is symptomatic, what you do is you do a surgical intervention is indicated. So surgical intervention is indicated. And under the surgical intervention, there can be very high risk. So in terms, it is very high risk. So what you do, there is a transcatheter mitral valve repair. So you do a transcatheter mitral valve MV repair. So this is in terms of if it is very high risk. So same way, if it is successful repair is possible. So in case the successful repair is possible. So in case a successful repair is possible, there are two outcomes. One will be the degenerative mitral valve disease. One is the degenerative mitral valve disease. So regenerative mitral valve disease means there is a mitral valve surgery. See. Next is in terms of the rheumatic mitral valve disease. So in terms of rheumatic mitral valve disease, the mitral valve surgery is done. So the mitral valve surgery, if you see, it is done. Next we move on to the stage C. So when you move on to the stage C, it is nothing but the asymptomatic. Now we go back to where we started. So stage C and D, D was symptomatic. Now we are looking at the stage C, that is asymptomatic. So stage C, there can be two stages, that is stage C2. So stage T2 will again move on to the type D directly. That is where the surgical intervention is required. Then you look for the high risk surgical. So if it is high risk, you do a transmitral valve repair. So this is as we discussed in the other part of the flowchart. So now moving on to the type C, we mainly focusing on the type C1. So type C1 means there's a possible outcome of the surgical intervention are evaluated. So here there is a possible outcome. So there's possible outcome of the surgical intervention, and there can be a successful repair if possible. So there can be a successful repair. If possible. So here, in case a successful repair is possible, there are two possibilities. One is a yes and a no. So if the answer is a yes, so in case it is yes, then you do a mitral valve surgery, so MV surgery. Or in case the answer is no, so in terms the answer is no, you do a sequential monitor. So you do a sequential monitoring, and after a sequential monitoring, what you do is a progressive deterioration, and again you go for a mitral valve surgery. To learn and grow daily like this, please do subscribe.